My name's Rebecca Chilvers.
Next.
I'm Dr. Daniel Skora.
Hi, I'm Dr. Satin Patel.
And I am Tessa with Fertility Specialists of Texas, and we thank everyone for joining us. The doctors are going to talk a little bit about fertility and COVID-19 and kind of what that means for our patients and for the fertility community in general. So we'll just jump in. On March 17th, ASRM released its guidelines regarding fertility care during COVID-19 pandemic, which, as everyone knows, included suspending all new treatment cycles, elective surgeries, and non-urgent diagnostic procedures. As a clinic, we were really quick to implement these guidelines and even instituted a little more conservative measures with the canceling of all embryo transfers after March 20th. Can you all just talk a little bit about these decisions and kind of what that means for our patients?
I can jump in here. Yes, so we decided to follow the guidelines of the American Society of Reproductive Medicine to halt all fertility treatment. I know it's been frustrating for a lot of patients that were in the middle of treatment and that were waiting for this moment, and we know it puts your life on hold. But given what's going on in our communities, not just locally, but also in our neighboring cities throughout the country, we feel that it's the safest thing to do for our patients, for our staff, and for the community. And we're really taking proactive efforts to hopefully play our role in terms of flattening the curve and just really putting safety first.
Anybody else want to add to that?
So I can add a little bit to that. Our governing body, as well as kind of local governments, have allowed us to finish active cycles that were ongoing. So people who were on IVF medications could complete, and we're about to finish our last retrievals for patients who are already in cycle. And then we did cancel all frozen embryo transfers that were after the 20th, so last Friday, per guidelines. The guidelines do state that we can still do emergency care and emergency cycles for patients, say, who have a cancer diagnosis, so we can do fertility preservation for those patients. So in that situation, we can still provide care under the guidelines.
So understandably, these guidelines sent shockwaves through the infertility community, garnering major media coverage, social media upset, and online petitions. Patients are understandably heartbroken about this. So what have you been hearing when you're talking to your own patients about having to cancel and postpone treatment?
Well, most of my patients obviously are, disappointed. There's been some tears, and I think the ones that are, finishing their cycle are appreciative that we're still here taking care of them. We're still doing obstetrical ultrasounds to make sure that, babies look good, and communicating with their obstetricians. But the ones that are, I've talked to them about why, and of course we're here and want to get going as soon as possible. So they are happy that we're, not going to stay shut down any longer than we, have to or need to. But they understand that we are taking a cautionary approach because there's not a lot of information about, this virus in patients with pregnancy. There's some emerging data. Some has been reassuring, and some has talked about like preterm labor and such. But I think that we've just talked about taking a wait and see approach and reassessing things. Every week it's an emerging situation that changes daily. So most of my patients have been upset, but then also understanding. Some, I think, canceling the transfers, I think, was the hardest thing. I wish that that had been different, but at the same time, I think they understand. And the other good news is those patients that have had to suspend cycles with frozen embryos, their embryos are waiting on them. They're safe. We're doing a great job to keep all our usual quality control measures in place so that we'll be able to, pick up, and those embryos will be ready to make babies soon.
I think what I've also heard from a lot of patients, probably the overwhelming sense that most people have, including us, is kind of not knowing when this is going to end. Right. And the uncertainty of that, I think, is really what is making the whole country and the whole world really uneasy right now of when is this going to end? When can we get back to normal? And unfortunately, we do not have an answer for that. We take it day by day, week by week. I've been telling patients who are waiting to cycle that, you know, as soon as we hear any hopes that we'll be able to start opening, we can consider putting you onto birth control for your IVF cycle. But, you know, we want to be as safe as possible and not jump the gun before we're allowed to do what we need to do. So, you know, mostly it's me saying to my patients, I'm here with you. We're going to be in touch with you as soon as things open up. But, you know, just reassuring that we are here for you as soon as things get back to normal.
I think that's really important to kind of emphasize that, you know, that's kind of the hashtag that's trending across all platforms, is that we're, you know, we're all in this together. And this really, more than anything, is kind of uniting everybody, even in just this fear of the unknown. We posted yesterday on our Facebook page and website that, you know, our patients, we wanted to reassure them that they are not alone and that our team is still here, that we're still working, even though clearly we're all social distancing and staying separate. So what, can you just kind of explain what services we're still offering right now until we can be fully functional again?
Well, we've actually put some of our diagnostic procedures on hold. That may change, but right now we're, you know, delaying HSGs, semen analyses, IUIs, and IVF cycles. You know, eventually they may allow us to do IVF cycles and bank, you know, embryos. I'm not sure, but right now we're abiding by the guidelines, which are pretty extensive at this point.
Right.
There are some risks, I know, for instance, with, you know, retrievals. If someone gets ovarian hyperstimulation syndrome, there's a little there's some increased risk, or talk about that in terms of if that person were to get COVID at that time. So we're taking measures to prevent OHSS, or ovarian hyperstimulation syndrome, in those patients. But you know, we're finishing up our retrievals, and then, you know, we're not sure when it's gonna open back up. But obviously we're all waiting and wanting to practice to get going.
And staff is still here. We're still answering the phone. Any questions that you have, we are answering those questions as best we can. Feel free to reach out to us. We're here for you. The staff is here. We're answering emails as best we can. Our third-party department is still coordinating with all of our third-party satellites, et cetera, as well. We are here making sure that we are as prepared as possible for when things open back up, that we can get fully activated as quickly as possible. So you guys can treat us the way that you always have. Call us, email us, etc. If there is an emergency, we are able to take care of you as best we can, okay? So we are here for you in case of an emergency, like concern for an ectopic pregnancy or bleeding in pregnancy, etc. We are here for you, okay? So, you know, we're doing as much as we can with this limited resources that we can through the law.
Right.
And we're just still doing consults in terms of like follow-up, so that we can make a plan of care, so we can hit the ground running once, you know, the restrictions are lifted. And, you know, we're even seeing new patients in terms of consults to get a plan in place, and then we can do the physical exam and the ultrasound and lab work at a separate date once it's safer for everybody to be out and about.
Which I think is really important, just to remind everybody, like right now, is if you were planning to come and see us, right now is a really great time, is to kind of schedule that chat with you guys like we're doing right now, so you can at least kind of get your foot in the door and get the information that you need, so that when we do open up, you know, you can hit the ground running, and you've already kind of got this initial conversation out of the way. And it's one little way to take back just a tiny bit of control in terms of your fertility process, because I think, you know, we all struggle with that. If you're, you know, 1 in 8 is having that complete loss of control. And now even more, we have no control even whether we can like go to a restaurant or things like that. And I think, you know, at least being able to talk to a fertility specialist right now and have that conversation is really, really important. So I'm really glad that we're all still offering that to our patients. Let me see. So is there anything specific that y'all want to talk about in terms of those patients that are still coming into the office for monitoring, in terms of our heightened safety precautions, or anything different that's going on in the office or in the lab?
I know they're using Lysol and extra sanitary precautions between patients and cleaning down the rooms. And, we're taking this seriously, but also want to be able to provide good care. So that's one thing we're doing. And we hope that patients are being upfront and honest about any exposures they've had or symptoms they have before coming into the office.
We're also spreading out patients throughout the day, more so, if you've been in fertility treatments and you've come to a clinic in the morning, early morning for your monitoring, it can be a lot of people. And obviously that's not what we want in this situation. So we're spreading the monitoring out that's still happening throughout the day to limit the exposure. We're trying to keep people seated far apart, 6 feet difference. And as Dr. Chilvers did mention, but we always do sanitary procedures between patients, even when we don't have something like this. So, I would say in the IVF and fertility sphere, we actually are really OCD when it comes to cleanliness in general, because those actually affect outcomes when it comes to getting pregnant. So, we are uniquely prepared to adjust ourselves for a situation like this. So, it actually wasn't that much of a transition for us. I think the biggest transition is the volume transition, because we had to stop so many services.
So Dr. Chilvers had mentioned this a little bit, but just talking about the fear surrounding COVID-19 and the infertility community, there's just not a ton of research and scientific evidence about how it impacts pregnancy and delivery of babies. So what do we know right now in terms of how this virus impacts pregnancy?
Fortunately, what we know about that right now is fairly limited since this virus is so new. There are some concerns that potentially patients may be at increased risk of early labor, and really the biggest concern for a lot of us is the unknown regarding potential risk of birth defects that patients do face with other viruses as well. But the reality is this is very new. We don't know. And we feel like the safest course of action is to be to be as proactive and to be extra cautious. So we're recommending our pregnant patients to really stay at home, limit their exposures even more so, since being pregnant is considered being in a relatively immunocompromised state.
So
about fever during pregnancy and early first trimester is a concern, just for any cause of a fever, is a concern for, baby's brain development. But most of the time they do fine. But, that's something that's been extensively studied across, different diseases during pregnancies. Fevers, dangerous during the first trimester. But just to add that.
So, what words of advice or encouragement can you offer to those who are kind of in this waiting period? They're on hold, they want to start, or they want to continue treatment?
I would say that we, along with you, feel your anxiety. Trust me, I'm not one of these people who's very anxious all the time, and I'm feeling anxiety for a variety of reasons as well. So we feel the same thing you're feeling. It might be different kind of anxiety for different reasons, but we're all in this together. That's kind of, the whole world is in this together right now. And we are here for you. We're not going to be anywhere in 2 months, hopefully, when we can start seeing patients again in person. Who knows if it'll be less or more than that. But we will be here and ready for you. And the vast majority of patients, 2 months is not going to make the difference between you not getting pregnant and getting pregnant. And those patients that 2 months do matter, like those patients who are about to start chemotherapy, we have dispensation to be allowed to treat those patients. So I don't want you to think, well, because of this outbreak, I have no chance of ever getting pregnant. We will make sure, that we are here for you no matter what time period happens. We're always here for you. So reach out to us, make a virtual appointment so that we can get the ball rolling. We still can do blood work remotely through, remote lab places that are open, so we can get the ball rolling so that we can start treatment as soon as we possibly can.
Anybody else? So we're just going to kind of wrap up. Did y'all have any other final thoughts that you wanted to share? Anything that you kind of want people watching this to know or keep in mind? Yeah.
Just all praying that this is going to be less severe than anticipated by some, and that, you know, protective gear is going to be more available, and treatment regimens for this disease will be more streamlined and available, and that, you know, I'm thinking in the next few weeks, maybe like up to a month, that we'll have a lot better outlook on all of this, and be able to give people a better understanding of when things are going to be available. That's my hope.
I would also say, like, you know, take care of yourselves, take care of each other. You know, we're all here for each other, even if we have to be at arm's distance, okay? You know, I understand the difficulty of this disease and what's going on in the world is that it's hard to see because, you know, we have to look 2 weeks ahead, right, of what it's going to be. You know, don't watch the news every hour of every day, because it's just going to increase your anxiety, and it increases mine. You know, try to limit yourself to an hour a day if you can. And, you know, but heed those warnings. You know, this is a very real and serious problem that we're going to be facing in the next weeks together. And, you know, we're going to come out of this on top at the end, but we all need to take care of each other. And right now what that means is staying at home as much as you can and doing whatever you can to avoid exposing yourself to others and the other way around.
And take your CoQ10 and your vitamins and stay on all that good stuff. Your vitamin D, you know, keep your eggs happy in the meantime.
And just practice social distancing. You know, like we really can't we can't underscore the importance of staying at home and treating this very, very seriously, because we can all individually do our part in hopefully halting this disease.
And I would just like to add to that is something that I keep reminding myself of is that it's very, very hard. I mean, it's very, very easy to kind of go to those dark, twisty places. And it's so important, no matter what is going on, no matter what we're facing, there's always, always, always something to be thankful for. And to just find that moment where you're just like, I can't hear one more bad headline, I can't take one more bad piece of news, is to just really be mindful of what is in your life that you have to be thankful for. Like really make it an intentional thought, whether like today the sun is out, I am so grateful to see the sun today, you don't even know. And it's just, that will really, really help. And find things to bring back some joy, whatever it is, connecting with the simple things in life, those walks and adult coloring books and, you know, Netflix and binging and things like that. I think that's really, really helpful. It's basic information and it's simple, but I think that's what we're all being forced to go back to, is go back to the basics. And I think like Dr. Skora and you and the rest of you said was, we'll come out on top, we'll come out stronger and better for this. So I just want to thank you guys for talking to me. And